Mike Berg, head of regulatory and clinical for Trukera Medical again. We just talked about hyperosmolarity, light scattering, and how it can affect your pre-surgical and post-surgical outcomes. Not only your monofocal, but your premium surgery patients. What do you do about that? How do you manage these patients? Well, here's the solution. If you have a hyperosmolar tear film, you got two contraindicated risks, okay? The first risk is that your pre-surgical measurements are going to be in error. How do you resolve that? You have two options, both simple. In both cases, you do not have to be a dry eye specialist. The first one is you just instill an eye drop in the eye prior to biometry. Now, we do know that when we saw from the data that it takes 10 to 15 minutes for that eye drop to completely subside the hyperosmolar effect of light scattering, okay? So those patients that you put an eye drop in, don't test them immediately. Secondly, if necessary, and you need to treat that patient, we now know that you just need to treat hyperosmolarity, not dry eye. And the studies show that you can bring hyperosmolarity down into the normal level in a 2 to 4 week period, which can easily be achieved between the pre-operative evaluation and the actual surgical date. So if you're going to put an eye drop in the eye and you have to wait 10 minutes, you don't want to do that for everybody because you don't want to affect patient flow. Who do you know you have to do that to? You do it with your hyperosmolar patients. If you have your hyperosmolar patients, you red flag them, you tell your tech, or your tech will already know because they did the test. Be more careful with those patients. Put an eye drop in the eye and make sure you're nailing the pre-surgical biometry. The second risk is visual quality, not acuity, quality after the post-surgical operation. This is the easiest part to resolve. First, you have to tell the patient two things. The first thing is you have a cataract. I'm going to take care of that, the surgeon. But you also have a second problem, and that's a hyperosmolar tear film, which will cause light scatter and visual fluctuations after surgery, sometimes as long as 3 to 6 to 9 months after surgery. And if you do encounter that and it bothers your vision and your quality of vision, you go see your dry eye specialist or come back to me and we will take care of your dry eye problem.